Nystop 100,000 units/gram topical powder is a medication used to treat fungal skin infections. It works by stopping the growth of fungus on the skin. This medication is typically applied to the affected area 2 to 3 times daily or as directed by your doctor. It is best to use this medication at evenly spaced intervals for the best effect. Be sure to continue using this medication for the full prescribed length of time, even if symptoms improve before the infection is completely cleared. This medication is for use on the skin only. Make sure to clean and thoroughly dry the area before applying the medication. Your doctor will give you specific instructions, but usually, it is applied 2 or 3 times a day. The amount and duration of treatment will depend on the type of infection. Avoid applying more often than prescribed. Apply enough powder to lightly cover the affected area and some of the surrounding skin. Remember to wash your hands after applying, unless you are using the medication to treat your hands. Do not wrap, cover, or bandage the area unless your doctor tells you to do so. If using in the diaper area on an infant, avoid tight-fitting diapers or plastic pants. Do not apply this medication in the eyes, nose, mouth, or vagina. For best results, use this medication regularly at the same times each day. Keep using it until the full prescribed amount is finished, even if symptoms improve. Stopping the medication too early may cause the infection to return. If your condition lasts after 2 weeks of treatment or gets worse at any time, be sure to inform your doctor. If you experience skin irritation or redness while using Nystop 100,000 units/gram topical powder, be sure to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's important to seek medical help immediately if you notice symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Before using Nystop 100,000 units/gram topical powder, make sure to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems. It's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, make sure to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to only use this medication when clearly needed and to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding. As for the optimal timing to take Nystop 100,000 units/gram topical powder, it is best to follow your doctor's instructions and the directions on the prescription label. Be sure to use this medication regularly to get the most benefit from it. And remember to use it at the same time each day to help you remember. If you have any questions about the dosage or timing, be sure to ask your doctor or pharmacist for clarification. When using Nystop 100,000 units/gram topical powder, it's important to be aware of potential drug interactions. These interactions could impact how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always seek your doctor's approval. This will help ensure the safe and effective use of Nystop 100,000 units/gram topical powder. If this medication is accidentally swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. Symptoms that may occur after swallowing include nausea, vomiting, or stomach upset. If you are a U.S. resident, you can call your local poison control center at 1-800-222-1222. If you are a Canadian resident, you can call a provincial poison control center for assistance. It's important not to share this medication with others. Nystop 100,000 units/gram topical powder has been prescribed specifically for your current condition. It's not recommended to use it later for another infection unless your doctor advises you to do so. If you happen to forget a dose, apply the missed dose as soon as you remember. However, if it is close to the time for your next dose, just skip the missed one. Make sure to continue with your regular dosing schedule and avoid taking a double dose to make up for the missed one. Make sure to store Nystop 100,000 unit/gram topical powder at room temperature and keep it out of reach of children and pets. Do not dispose of the medication in the toilet or drain unless instructed to do so. When the product expires or is no longer needed, be sure to properly discard it and consult with your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.